Hello, my name is Eileen and I'm going to be your nurse today. I'll be performing a assessment of your thorax, lungs, and heart. Is this okay with you?
Mm-hmm.
Okay. Thank you. Before I begin, I'm going to go ahead and perform hand hygiene. So let me go ahead and wash my hands really quick. Can you please state your name and your date of birth, please?
John Doe, November 3rd, 1997.
All right. Thank you so much, John Doe. For your privacy, I'll make sure that you're properly covered and only expose the areas that are needed for this assessment, okay?
Okay.
All right. Are you comfortable sitting there?
Yeah.
All right. Before I begin, I'd like to ask you a few questions. Are you experiencing any shortness of breath, chest pain, cough, dizziness, or heart palpitations?
No.
No. All right, perfect. Do you have a history of asthma, COPD, pneumonia, heart disease, hypertension, or any other respiratory or cardiac conditions?
No.
Okay, great. So during this assessment, just let me know if you experience any discomfort or any pain or you want me to stop, okay?
Okay.
All right, so I'm gonna do your thorax and lungs. So first I'll begin with the respiratory assessment, and I'd like you to be sitting upright. And so first I'm going to inspect the patient's respiratory status and thoracic configuration. Slightly lopsided due to the shoulder injury, but despite that, his chest looks great. It's very symmetric. I observe that his respirations are even, regular, and unlabored, with no use of accessory muscles or signs of respiratory distress. The thorax appears to be symmetric. Let's see. So now I'm going to start with palpation. That means I'm just going to touch, okay?
Okay.
So I'm just going to touch the back of your thorax, the posterior thorax, for tenderness or deformities. So if you can just lean forward just a tiny bit carefully. All right, so the back looks good. I'm just going to check for any masses or abnormalities. Looks great. I don't see anything abnormal or any bony deformities noted. So I'm gonna assess the tactile fremitus. So what I'm gonna do is I'm gonna have you put both your arms forward.